So, what's one of the most important jobs for any clinical leader that almost always gets overlooked? It's building your brand. Now, I know what you're thinking. That sounds like a job for the marketing team, right? Well, today we're going to explore why it's actually your job. And we're going to lean on the incredible ideas from Marty Neumeier's book, The Brand Gap, to guide us.
This whole topic really got going after a discussion we had in the Culture Coalition. We started asking ourselves, what does brand even mean in a hospital or a clinic? Is it just about the logos on our buildings, or is it something way, way deeper? So let's start right there with a big question to frame this whole conversation. What if branding has nothing to do with marketing campaigns and everything to do with the trust, the safety, and the confidence that you and your teams are building one interaction at a time? Okay, let's really dive in. Because to get what a brand is, we first have to bust some myths about what it is not. And this is where Marty Neumeier's work is just so helpful. First things first, a brand is not a logo. I mean, a logo is useful, for sure. It's a visual shortcut, but that's all it is. Thinking your logo is your brand is kind of like thinking your driver's license photo is your entire personality. It's just a symbol. Second myth, a brand is not your actual product or service. You know how we talk about choosing a brand of medical device or a certain brand of EMR? We're really just picking a product. The brand is the feeling, the reputation that comes with that product. And finally, and this one's a little tricky, a brand isn't a promise. A promise is what you say you're going to do. A brand is the result. It's what people believe you've actually done. It's the outcome of all those promises you either kept or broke. So, if a brand isn't a logo or a product or a promise, what in the world is it? Well, this is the part that changes everything for us as leaders once you really get it. And here it is. It's so simple, but so powerful. A brand is a result. It's a person's gut feeling. See, it's not something you decide on in a meeting. It's something that gets created inside the minds and hearts of your patients and your staff. It's their intuition about you. And let's be honest, in healthcare, that gut feeling is absolutely everything. It's a patient feeling like they were actually listened to. It's a clinician feeling like their team has their back. It's a family's deep down sense of safety knowing their loved one is in good hands. That's the brand. Okay, so this leads us to a huge challenge that Neumeier talks about, and it is so relevant for us in healthcare. He calls it the brand gap. It's that canyon between what we say we are and what people actually experience with us. This slide just illustrates it perfectly, doesn't it? Over on the left, you've got strategy. That's all the logical stuff we can write down. Our mission statements, clinical protocols, safety data. But on the right, you have creativity, the actual lived experience, the bedside manner, the morale of the team, a family's real story. A great brand is what happens when you close that gap. So the big question is, how do we do that? How do we as leaders actually build a bridge over that gap? Well, the good news is Neumeier gives us a super clear, actionable framework. He calls it the 5 disciplines. So here they are: differentiate, collaborate, innovate, validate, and cultivate. These are the building blocks. This is how you turn a mission statement on a wall into a real lived experience. Let's just quickly break down what they mean for us. All right, first, differentiate. What makes the carrier team provides truly unique and special? Then, collaborate. This is huge. It means getting everyone to feel like they own the brand, not just one department. Third, innovate. You got to constantly be looking for new ways to make the experience better for patients and your team. Fourth, validate. This is absolutely critical. Ask for feedback. Does the experience people are having match what you intend for them to have? And last, cultivate. A brand is like a garden. You can't just plant it and walk away. It needs constant care and attention. And all of this, it all leads to one final massive point. This is not somebody else's job. This is a core function of your leadership every single day. Because that gut feeling we keep talking about, it isn't created by a TV commercial. No way. It's created by the tone of voice on the phone, by the clarity of an explanation from a doctor, by the empathy of a nurse, by every single person on the team. Every single one of them is a brand manager. I absolutely love this quote from Danny Meyer. And just think about that word, transaction, in our world. A transaction isn't about money. It's a patient encounter. It's a team huddle. It's a difficult conversation with a family. Every single one of those is a vote. A vote either for or against the trust you're trying to build. So I want to leave you with this one question to take back with you. Just forget about the mission statement and the marketing for a second. Think about the human result of the work you do. What gut feeling, what genuine, human gut feeling did your team create for your patients, for their families, and for each other today? Thanks for joining me.